In this video, we are going to define what percussive therapy is and how it might fit into your recovery and training process. We're also going to take a look at some of the evidence for percussive therapy and the vibration and massage therapy techniques that it's based upon in the literature. We're also going to hear from an expert athletic trainer / PhD about how he sees percussive therapy fitting into the overall recovery and healing process from injury for athletes. And we're going to take a look at some different devices that you can buy right now on Amazon and talk about some of the features of them that you might be looking for when you're trying to make a purchase. And at the end of it all, hopefully you could decide for yourself whether or not percussive therapy is overhyped. Percussive therapy is a contemporary modality in the realm of soft tissue manipulation and treatment. It's characterized by the application of rapid, concentrated pulses to the body's muscle tissue. These mechanical stimuli are typically generated by a handheld device, which impacts the skin and underlying structures in a controlled and rhythmic manner. Now, it's theorized that these rapid pulsations create oscillations in the muscle tissue, which leads to a relaxation of the muscle fibers and facilitates improved blood flow. This technique is thought to assist in the release of myofascial restrictions. The fascia, remember, are those sheets, the bands, webs of connective tissue that wrap around and are continuous with your muscle fibers. And it's thought to release these restrictions, thereby improving mobility and decreasing discomfort. And finally, it's thought that through the mechanical vibrations, they may stimulate sensory receptors within the muscle cells themselves, which would then lead to a decrease in pain according to the gait control theory of pain. So let's break down what research has to say about percussive therapy. So it's thought that percussive therapy or massage therapy or vibration therapy can enhance localized blood flow and thereby increase the oxygen saturation of the tissue. It's thought that the synergistic interaction of mechanical stress and vibratory stimulus culminates in the generation of heat and the liberation of nitric oxide, subsequently inducing vasodilation. Remember, vasodilation is the opening up or relaxing of blood vessels to allow more blood to come through. The next benefit is vibratory analgesia. Now, this is a fancy way of saying decreasing pain through vibration. Now, both mechanical pressure and vibrational stimuli are known to influence the pain perception and sensitivity to pain via distinct pathways. Given the inherent characteristics of percussive therapy, its analgesic outcomes are conceivably attributable to both of these mechanisms. Now, the analgesic effect of the mechanical pressure is due to the gait control theory of pain. The gait control theory of pain, in short, is this theory that there is some sort of a gate in the spinal cord which opens or closes to different sensory stimuli, and only so much stimuli can flow up through that gate to be processed by your brain. And so if you have pain sensation and then suddenly overwhelm that pain sensation with a mechanical stimulus, suddenly it's drowning out that pain and you no longer feel it. It's the reason why if we get, let's say, a sting or a shot or someone flicks you or pinches you, you rub that area in order to mask out the pain. That's the gait control theory of pain. The other mechanism is the vibrational stimuli, and that has an analgesic effect because it's involved in the recalibration of pain encoding within the somatosensory cortex itself. The next potential benefit is muscle thixotropy. Muscle thixotropy refers to the time-dependent reversible alteration in muscle stiffness and viscoelastic properties that occurs in response to mechanical perturbations such as stretching or shortening. In essence, a muscle's resistance to deformation changes depending on its recent mechanical history. And so this might be one reason why things like foam rolling or the use of percussive massage techniques actually enhances the fluidity or the pliability of the muscle tissue, and might be one reason why people just feel better after doing it. The next potential impact of percussive therapy is on muscle tone and range of motion. Now, within the muscle, there are these things called mechanoreceptors. They are small proprioceptive cells that reside in the muscle itself, and they sense changes to the muscle, such as vibration, pressure, application of force, duration of force, the state or length of the muscle, the onset of a rapid stretch, etc. And it's thought that percussive therapy can actually modify the response of some of these mechanoreceptors in a way that leads to an increased range of motion, relaxation, inhibition of the agonist muscle and the antagonist muscle. It can lead to enhanced motor control, potentially. Percussion therapy's vibrational aspect, we know that it stimulates type 1A muscle spindle mechanoreceptors, which could potentially augment the stretch reflex. Now, the next potential benefit that I'm sure all of you are interested in is a decrease in DOMS, or delayed onset muscle soreness. Delayed onset muscle soreness is a phenomena characterized by pain, stiffness, swelling, and weakness following training that typically manifests within 24 to 72 hours, hence the D or delayed. Now, the symptoms are particularly prominent after activities that involve eccentric muscle contractions, such as weight training, or where the muscle is lengthened under heavy load. Remember the last time that you did Romanian deadlifts with a pause at the bottom and a ton of weight in your hamstrings, maybe not right away, but after 12, 24, and definitely within that 24 to 72 hour range, just felt massively sore. Yeah, that's DOMS. Now, when applied pre-activity or before you weight train, it can mitigate elevated markers such as CK, LDH, and IL-6. Now, these are markers of fatigue. They're biomarkers, so creatine kinase, lactate dehydrogenase, and interleukin-6. And these are shown to be elevated in the bloodstream after training. Well, with percussive therapy, some research has shown that we see a decrease in some of these markers. Now, percussive therapy might also enhance tissue remodeling. It doesn't do this under all circumstances, but it is especially beneficial if you have a patient or athlete who is immobilized, or if part of their body is immobilized due to injury or illness. So in the absence of mechanical influences such as movement, stretching, pressure, soft tissue adapts to that lack of demand. And you can have things like a reduction in strength, a reduction in motor unit output, a reduction in range of motion or mobility or flexibility. Percussive therapy offers a potential way to maintain some of these, or at least to delay the loss of some of these qualities in a passive way. So especially if somebody cannot move a certain joint or muscle, or if they're bedridden, we can use percussive therapy to stimulate some of those mechanical and electrical properties of the tissue. Now, in the context of percussive therapy, pressure and vibration acts as the passive stimuli that are transduced into electrochemical events. And these in turn activate signaling pathways that could contribute to this tissue adaptation. Now, the last potential benefit to cover here concerns the belief and or the placebo effect. And really the placebo effect is this idea that if you think something's going to work for you, it probably will. And research has shown that on average, we have about a 23% boost if we really believe in an intervention. Now, tied into all of this is how you or the athlete that you're using this with feels at the end of therapy. Do they feel good? Do they feel relaxed? Now, the administration of percussive therapy has been shown to yield diverse perceptual outcomes, particularly concerning subjective recovery, anxiety alleviation, and relaxation. Individuals in the literature often report a sensation of refreshment or decreased muscle soreness, which could psychologically predispose them for subsequent physical activity. So if you feel good, you're more likely to go out and exercise again. Anxiety alleviation, so the rhythmic, repetitive nature of percussive therapy and that sensory feedback that you're getting, it oftentimes feels good, and oftentimes you're forced to relax through some of the sort of ticklish, sort of squeamish feeling if your muscle is overly tight. And as you relax, now that anxiety is starting to dissipate, or at least that's a subjective feeling of it. And this can evoke a sense of calmness in an individual that acts as a form of sensory distraction and mitigates feelings of anxiety. And then finally, relaxation. So relaxation is the other piece of this, and the mechanical stimuli from percussive therapy may engage parasympathetic pathways and transition an individual from that sympathetic state into a more parasympathetic state, perhaps through mechanisms like decreasing heart rate and decreasing cortisol levels. So at the end of the day, these belief effects, even if nothing else is true up until this point, these belief effects are very strong. And as I mentioned previously, contemporary literature underscores that the placebo effect can yield massive benefits even when compared to actual psychological and physiological interventions. Now that we've gone through some of the potential benefits of percussive therapy, let's take a look at how it's used in a real-world scenario with athletes.
So as a sports medicine professional, there's a lot of really good use cases for percussive therapy. I think the number one use case is actually to use it for pain. So not only does percussive therapy have short-term pain relief, but it also has a little longer-term pain relief, about 15 to 30 minutes after the treatment. It does this by two ways. The first way being the gate control theory, which is essentially just tricking our brain to focus on the stimulus at hand or the percussive forces instead of the actual pain. And the second way is through descending pain pathways with the release of enkephaline. So in other words, percussive therapy is going to cause a brief, intense, maybe even painful stimulus. And that causes our brain to actually release a neurotransmitter to help block some other deeper pain receptors that we have. Now, the second way sports medicine professionals can use percussive therapy is really to reduce any spasms that are left over from the initial injury, or maybe even some new spasms that have developed as a result of our rehab. Maybe we're starting to return into training, and that caused some spasms to develop in those damaged muscles. And so this is where percussive therapy can be really beneficial, because what it does is it's simulating, or it's sending stimuluses into our mechanoreceptors and causing our trigger points where those muscle spasms are held to actually release and relax. And so this could cause some systemic relaxation, not only regionally, but also too locally within the tissues. And where percussive therapy really gets its science backed up is from whole body vibration therapy. And so there's a lot of literature to support the uses of whole body vibration therapy for chronic pain conditions, chronic injuries, et cetera, And this is just really a more localized, more regional approach. Instead of doing whole body, obviously we're targeting specific muscles and specific areas of the body. And so there's a lot of really good use cases for percussive therapy as it relates to muscle spasm relief. So how do I use this in every single day clinical practice? Well, the great thing about this tool is not only is it small, but it's also very portable. And so it has a lot of use cases, not only in a clinical setting, but out on an outside setting. Let's say I'm out on the field, I'm in the gym, or I'm traveling with the patient to a game, or even the patient can take this with them themselves and apply the therapy if I'm not able to be there. And so I may not be using this, day 1, day 2, day 3 after the initial injury when we're in the inflammatory phase. But as we progress into that proliferation phase, day 4 to day 5, that's when I really want to start targeting those muscle spasms. And then I'm going to get that added bonus of that pain relief. And so for this example, we're going to use it on the levator scapulae and upper traps. A lot of people with chronic neck pain often have spasms in these areas. And so I can just go ahead and turn on the device and go ahead and start to apply pressure and really work on these target areas where there's trigger points and spasms to help cause a systemic release and a relaxation of the tissues. Now, you see, this is really similar to maybe what I would do if I were giving this patient a massage. But the nice thing is this saves my hands, and so I'm able to not only give a more consistent treatment, but also to a longer treatment because I'm not going to be dealing with fatigue on a day-to-day basis. And like I said, from an athlete's perspective or a patient's perspective, if I'm not around to maybe treat them, they're able to do this on themselves and still get the same benefits that they would if I were applying the treatment. Perfect.
Now, it's important to remember that percussive therapy is one potential piece of the overall recovery strategy. Things like good sleep, adequate nutrition, stretching, foam rolling, a really good warm-up before activity, a good cool down. None of these should be neglected. Furthermore, we should recognize that percussive therapy, although it's supported in the literature, a lot of that literature was actually done with vibration training or with massage therapy or therapeutic touch, as it's often called in the literature. And we take some of those claims and we infer the benefits onto percussive therapy because it's in some cases similar to either the mechanical stimulus or the neuromuscular stimulus to some of these modalities. So it may not be better than massage, better than vibration. It might supplement them, or it could be equivalent to them. Research isn't yet clear. That said, percussive therapy can be a very convenient tool for you to use in your own recovery strategies. So you might be asking yourself now, what type of device should I purchase? Well, I'm glad that you asked. First of all, don't purchase anything if you don't feel like you need extra recovery between your sessions. If you're recovering just fine, then save your money, spend it elsewhere. But if you do think you need that edge, here are some things to look for in a massage therapy gun. Now, for the purposes of this educational video, I will be using this tool from Bob and Brad, the world's most famous physical therapists. Check them out on YouTube if you haven't already. This is the D6 Pro. It's the top of the line massage gun from their brand of massage guns. And I was sent this free of charge for my unbiased, honest review. And so what I've chosen to do here is I will just give you the specs of this gun as I go through things that you should be looking for in a percussion tool. Now, I unboxed this tool about 3 weeks ago. It smells like a new car. Ooh, that is nice. This is good. Oh, that's nice. Oh, this just feels really great. And my wife and I have been using it ever since. She's a competitive runner. She uses it after her training run. Sometimes she has 2-a-day workout sessions, and so she's using it on her calves, she's using it on her quads, on her hamstrings. I use it primarily as a way to warm up for weight training sessions. I have particular muscle groups that are sore or tight or stiff before training, and so I use it to modulate pain through that gait control theory. I use it to improve my range of motion by enhancing blood flow to an area and just to get it that spot warm before I even start warming up, because I train early in the morning, and sometimes you just don't want to get on the ground and foam roll at 5 a.m. in the morning. And so this tool has been a mainstay in my training and recovery process for the past 3 weeks. But let's get into what you should be looking for in a massage therapy tool. So the first is the amplitude of the device. The amplitude refers to the distance that the massage head travels back and forth. A higher amplitude generally results in a deeper massage and a better effect on those deeper muscles. Now you can get away with lower amplitude of say 10 millimeters. It ranges from 10 up to 16. This D6 Pro has an amplitude of 16 millimeters. So this head oscillates quite far. See there, that's the distance, right? That it's pounding into your muscles. Something like this that I got on Amazon, super cheap, a couple years ago, has more like a 10 millimeter range. It's very small. It kind of feels just like it's a, I don't know, like it just vibrates, and what are vibrators really good for? The next thing to look out for is revolutions per minute or strokes per minute. This is just the speed at which the head oscillates. Typically this ranges from about 1,500 all the way up to 3,000 revolutions per minute or strokes per minute. Personally, I like the lower end of that range. So I'm not going to be upset if, let's say, my massage tool of choice has 2,500 RPMs instead of all the way up to 3,000, like this one has 2,500. But that's fine, because I'm usually in the 2,000 and below range. Anything higher than that, and just causes my muscle to really seize up. And so I like to stay at the lower range. For me, amplitude is more important. Now, the next one is the torque or the stall force. And this is the amount of pressure that the device can withstand before the motor stalls. So the harder you push into your muscle and the tighter and denser that tissue is that you're trying to massage, the more torque or stall force that you need. Something, again, like this tool has very little stall force. This tool has a lot. Now, the issue with having a lot of stall force, this one has 85 pounds of torque or stall force, is that you could bruise sensitive tissue. Okay, so you have to be careful on people who might bruise easily. The D6 Pro, if you're a smaller individual and you bruise easily, it might not be for you. You might want to go for a lower tier product. If you have more muscle, if you don't bruise easily, if your muscle is thick, if you're a little bit padded with non-muscle tissue, then you might want to go for the Pro. Next, you want to look for battery life. Now, of course, the battery needs to be able to last you through at least a couple sessions without charging it. The D6 Pro has 180 minutes of battery life. And just for reference, when I use this, I'm using it for about 5 to 8 minutes at a time. So, do the math. That's a lot of sessions that you can use this for without charging it. And it does take a little while to charge. It charges in a few hours, but that's it. It has a big, massive battery. And so it lasts for a long time. The next thing you want to be aware of is the noise level. Now, some of these things can be very loud. And generally, quieter devices obviously are less disruptive than louder ones. So if you're going to be using this in a spa or a therapy area, treatment room, and noise is an issue, maybe look for one that has a quieter motor. This is purported to have a 20% quieter motor than other competitive products. I don't have a way of testing that, so got to take their word for it. Next is ergonomics and weight. So you probably noticed the three that I've shown you so far. This just has the basic, thick handle that you can use, and you wield it and point it like any other sort of device with a handle like that, like a drill or something. This has an interesting design. You've got multiple handles. I actually like this because you can angle it. You can, use it on yourself like this, and you have multiple gripping points. You can have a double-handed grip. It's just very, very versatile. Something like this tool that I've had for over a decade. My wife bought this for me in one of our first couple years of marriage when I was still a competitive track athlete. This is very unwieldy, okay? You've got this little handle right here. All the weight is out here, so you have to use a lot of sort of wrist and forearm strength to really maneuver this thing around. I do like that it has two heads, though. That's kind of cool. Next are the different attachments or heads. So they come with these different types of attachments or heads, which do different things depending on the shape and the density and the surface area of the actual head. And so in a minute, I'm going to go through all of these heads that come with the D6 Pro and tell you what they are used for. Lastly, we have price and warranty to consider. Of course, the more features and the better the amplitude, the frequency, the better the stall force, the bigger the battery, the quieter the motor. All of those things will tend to increase the price. And so, of course, you just want to look for the best intersection of features that you need and the price that you are willing to pay for it. Now, if you're interested, you can check out a link in the description to the D6 Pro if you want to consider adding that to your recovery strategies. I personally will keep this in my recovery strategies until probably it dies because it's been great. Now, the D6 Pro did come with all of these fancy attachments, and so I do want to run through them one at a time and tell you what each of them do. So first we have the spade tool. This is great for pinpoint muscle treatment, trigger points, and small muscles like the hands and the feet. You can use it for shoulder blades, IT bands, scraping, and flushing the tissue. The next one is the damping head, which works well for a comfortable treatment of more bony or tender areas, say close to the spine where you don't want to hit the spinous process, or in areas where there's not a lot of muscle mass, but there's some bone below it, like around the scapula. Now, the large ball is great for muscle groups like the glutes or the quads, although personally I prefer the other material, the silicone material, to this one, which is, it's just like kind of foamy. It does feel fine on glutes or quads. Next is the standard ball. This is a more targeted option for overall use. It's really good all around. I tend to just keep one attachment on and just kind of use it for almost everything unless I have a very specific need in that moment. And so something like the standard ball is great for that. The air cushion is for those extra sensitive areas. And before you try what I think you're thinking, know that it also specifies in the manual not to use this on your genitals. So when they say sensitive areas, they don't mean that. But you can use it, again, around the spine. So for your erector spinae, to avoid hitting the spinous process. Maybe you're having tension headaches and you can use this to take some of the kick out of the percussion, and you can use it on the neck. Of course, be very gentle. You want to use the floating technique where you start by just sort of floating it above and then slowly adding pressure so that we don't cause any discomfort or bruising. The next one is the flat head. And this is good for trigger points or the low back if you really need to get in there and get into a very specific point. And again, the more or the less surface area, the more pressure is transmuted through that point. And then we have the bullet. This is good for pinpointing those smaller trigger points and smaller muscle groups. So let's say you have a knot in your muscle in a small area where you really need to get in there and be sniper accurate, the bullet is good for that. And just about any massage gun that you buy nowadays is going to have multiple heads that come with it. They might have different names, but they have similar uses. So hopefully in this video, you learned that there is some decent evidence in the literature for percussive therapy. However, it may not be any better than going and getting a massage or doing your dynamic stretches before and after training, doing some foam rolling. However, it might be more convenient. It might be more time effective. But here's the thing. Oftentimes those higher levels of performance are unlocked by getting through a bottleneck. Okay, maybe that bottleneck is better nutrition. Maybe that bottleneck is that you need to dial in your training load. Maybe you're training too much, maybe too little. Maybe it's the exercise selection. Maybe it's the fact that you're underslept. Or maybe it's one of your recovery modalities that you're not doing and that you need to implement. If some specific joint stiffness or muscle soreness or the inability to fully recover within the musculature between training sessions is what's holding you back, then maybe something like a massage gun or similar percussion therapy tool could be a good option for you. So as always, I recommend that you consult the scientific literature, listen to multiple expert voices, make sure that you know where the money is coming from for those expert voices and that they're not influenced or biased in some way. And if they are, take it with a grain of salt. And lastly, make sure you just try it out for yourself. Does it make you feel better before you train? Do you have better training outcomes? I know that for me, I'm going to keep this in the rotation as far as my recovery modalities go, but you're not me. You might have a different set of needs. So choose wisely, my friends. Check out the links below if you're interested in this D6 Pro from Bob and Brad. Also, check out those links for more sports science information, strength and conditioning knowledge, and educational material from your very own. And I will catch you guys in the next video.